discuss some breastfeeding issues today. Young mothers in today's hectic world are finding it very difficult to breastfeed their babies. This could be either because of working mothers or difficulty in the technique of breastfeeding, the baby is not latching on properly, or it could be multiple factors leading to a lack of breastfeeding. Actually, breastfeeding is the most natural act in the world, providing wholesome nutrition to the baby along with strengthening the bond between the mother and the child. So these problems have to be sorted out, and we have to make sure that the mother can sufficiently breastfeed the baby for a period of at least 2 years. In olden times, what used to happen was there were large joint families, there were elderly ladies, and they would help the young mothers, the first time mothers, to breastfeed. They would guide them and the process would go on smoothly. But nowadays, with nuclear families and first time mothers having actually no help, they really don't know how to breastfeed the baby properly. The baby doesn't know how to breastfeed properly, so the baby has to learn as well as the mother has to learn the correct technique of breastfeeding. In this, they can be supported by the hospital where the delivery has taken place. The delivery could be a normal delivery, it could be a cesarean section, and the mother actually finds it very difficult to breastfeed in the first few hours or days after the delivery because of the pain associated with the cesarean section or the normal delivery. But still, a very strong effort has to be made by the mother to feed the baby, and a lot of patience and commitment is required for this. And why do we insist so much on breastfeeding? It has a lot of benefits. Lack of breastfeeding, first of all, can lead to infections happening in the breast. It can lead to abscesses, which is pus collection in the breast. And why does this happen? Because the milk gets stagnated inside, bacterial contamination takes place, and small lumps happen and they become red, inflamed. In severe cases, there could be a very high grade fever with chills, and there could be excruciating pain associated. So all these are conditions which will really trouble the mother as well as the baby both. And the treatment for breast infections and abscesses obviously starts from basic antibiotics to higher antibiotics to ultrasound guided aspirations, and sometimes the mothers may require to undergo a surgical procedure to remove the pus. So it's not a good condition, and it can be easily prevented by adopting good techniques of breastfeeding. Then lack of breastfeeding also leads to other problems in the mother, like it can lead to increased risk of breast cancer. Then it can also lead to a lack of immunity in the child. The maternal antibodies pass from the mother to the baby through the breast milk. So if the child is not breastfed, obviously the child is not going to have these protective antibodies to fight diseases later on in the life, and that leads to a deficiency of antibodies in the baby. So that's an important effect that the breastfeeding can prevent. Then lack of breastfeeding will also lead to obesity in the mother and the baby, leading to lifestyle issues later on. Artificial milk that is given to the babies, if the baby is not breastfed, that has a lot of sugar, added sugar, and that can lead to diabetes and hypertension later on in the life of the baby. So as you can see, there are multiple side effects of not breastfeeding the child, and all these have to be avoided. We have to encourage good breastfeeding techniques. So what is the correct technique? A lot of patients ask me. The correct method is for the lady, the mother, to sit comfortably with pillows supporting her back, take the baby in her arms, the baby's mouth facing the breast, and the mouth has to latch on to the breast on the areolar margin. Areola is the black skin which is around the nipple, and the baby's mouth has to hold the margin, not the nipple, and the rhythmic sucking movement of the baby's mouth has to be on the areolar margin to push the milk out and into the baby's mouth. So many times, because this technique is wrong, the baby is not able to breastfeed and the mother doesn't know what has gone wrong. So maybe an elderly lady or even the hospital doctor, the nurses, the lactation specialists, anybody can teach the first timer mothers this correct technique, and this will then lead to a proper breastfeeding for both the mother and the baby. And once this is learnt, then it's a smooth sailing for both of them, and then both of them will enjoy all the benefits, and the maternal and the child bond will strengthen much more.